Some health unions and a local MPP are voicing their concerns tonight over a private clinic in Ancaster that is charging for primary care. The clinic is run by nurse practitioners, and the group says since they can't bill OHIP, it is completely legal. Manisa Danabalan joins us live with more on this. Good evening, Manisa.
Good evening, Taz. Holistic Solutions NP, that's the name of the clinic that opened at the beginning of this year. And the lead nurse practitioner says they would love to be publicly funded, but they can't. And there's a dire need for family doctors.
Care is better than no care. For some people who have to wait on a wait list for 2 or 3 years, they're running out of time.
Christopher Savard is the lead practitioner for Holistic Solutions NP. He launched the clinic at the beginning of this year. So far, it has about 30 patients, and he says most of them came because they're on a wait list for a family doctor.
We're fully in favor of publicly funded clinics. Unfortunately for us, we can't bill OHIP. So this is our only option if we want to have independent nurse practitioner clinics.
According to the website where you book appointments, a same-day urgent visit is $80. An initial mental health assessment is $240, $120 for a checkup for kids, and $80 for a follow-up visit with some exceptions. The Nurse Practitioners Association of Ontario says a clinic like this where patients pay out of their pocket for primary care is allowed.
If you've looked at the Canada Health Act, it actually covers services for physicians and hospitals. So nurse practitioners aren't implicitly mentioned in the Canada Health Act.
Michelle Acorn says there's an overwhelming demand for health care, and these clinics are helping with the problem.
This is in response to publicly needed, accessible care. So it's almost a stopgap measure at this point in time, and they're trying to respond to the community needs. Unfortunately, due to some of the public funding models that are happening right now.
But the Ontario Health Coalition and the Registered Nurses Association of Ontario says it's still not okay and it's not a temporary solution.
No, because they're charging.
I question the motive, actually. It's not in accordance to the spirit or the intent of the Canada Health Act, and RNO does not support user fees at all.
Several health unions and MPP Sandy Shaw say it falls back on the government to do more to fund health care.
This solution is a privatized solution. It shouldn't be the case. We should have public dollars going into our public system because people should get health care no matter how much money they have.
In a statement, the Ministry of Health says at this time, services delivered by nurse practitioners who are not part of a nurse practitioner-led clinic are not covered by OHIP. It is a violation of the Commitment to the Future of Medicare Act to charge an individual for an OHIP-insured service or a component of an insured service. Last week, the province announced that it is investing $110 million to connect more than 300,000 people with primary care teams. And this could mean more NP clinics that could be publicly funded as well. Back to you.